Hello everybody! Today we are talking about knee meniscus injuries, and we are excited to share with you all this great information about what can happen if you have knee pain and think you might have tore your meniscus or injured your meniscus. I am Dr. Janae Brown, and I am accompanied by my three favorite physical therapists. On my left is Dr. Bay, and on my right is
Dr. Daisuke.
And on my very right is
Other right, Dr. Sandoval.
So we are physical therapists at Physical Therapy San Pedro, and we're just going to dive in here and talk a little about meniscus injuries. So sometimes, at some point in your life, you might have had some knee pain and thought maybe that you tore your meniscus. Maybe you went to your surgeon or an orthopedic doctor, or you were with your personal trainer. Someone told you that maybe you have a meniscus injury and you're having knee pain. And so our goal with this particular blog right now is, in discussion together, is to give you guys some information about what a meniscus injury is, maybe some symptoms that you might be having if you have a meniscus injury, go over some potential mechanisms of injury, of how these meniscus injuries occur, and give you guys some insight into what rehabilitation for a meniscus injury looks like, and talk about maybe some different types of them, because there's different types of meniscus injuries that might impact how your rehab will go. So Dr. D wrote this blog. It is a fantastic blog, and it is just full of stuff, great stuff, all for you. So Dr. D is going to take us through some anatomy first. So Dr. D, talk to us a little bit about the meniscus and sort of anything we need to know about the anatomy of the knee as it relates to the meniscus.
Okay, so we have our handy dandy model here, so we're just going to go over the anatomy itself. So what the meniscus is just a fibrocartilaginous structure right in between the knee joint itself. So right in between the femur or the thigh bone, and on the other side is going to be the tibia or the shin bone. So if you can kind of see these blue little structures right in between the knee itself, those are going to be the meniscus. On the inside, let me make sure I got this right. Okay, so this is the right thing. So on the right side is going to be the lateral meniscus, and then on the inside is going to be the medial meniscus. So with the difference between some of these structures itself is the medial meniscus does have some different attachments compared to the lateral one. So the medial one has an attachment to what is called the joint capsule. It's going to be a bubble just that surrounds the knee joint itself, and also it has an attachment to the MCL or the medial collateral ligament. So that's why sometimes when people have injuries with their ACL or the MCL itself, it has some combinations of injuries that include the medial meniscus itself too. So when it comes to the function of what the meniscus does, it transfers load, it has some functions of shock absorption as well, and also with how it's shaped itself too, it almost looks like a cup. So if you can kind of see the bottom part of the femur or the thigh bone, it's rounded, so it makes like a cup that it surrounds the joint itself, so that it can move a little bit smoother as it starts to bend and extend.
Awesome. And you can oftentimes see the meniscus better from the back, so you can see like here as well. Sometimes we'll show people from the back. Sometimes from a front view, the patella covers it, so on the front of the knee. So that's another view of it. And also, if you bend the knee, right, you can kind of see some of that meniscus inside there, those little cushy guys. Mm-hmm. Cool. Thanks for going over anatomy. It was awesome. Okay, so we're going to talk about mechanism of injury. We have fun here, okay?
It was awesome.
Fun. So it was juicy stuff. Okay, good refresher for us too. So we're going to talk about mechanism of injury and symptoms, and Dr. Bay is going to go over those things with us today.
Yep. Here we go. Meniscus injuries typically occur when our knee is in a bent position, and there's a variety of different forces that can happen. So two big ones are rotational forces, which would be like twisting, and shearing, which is a front to back gliding or sliding. And lots of times during different sports, we're going to see these when we quickly move faster, acceleration, or slow down our speed, deceleration, changing of direction like cutting, also when there's just collisions or trauma. And then lastly, if you've had poor movement patterns causing a lot of excessive rotation and shear just over time in your joint, we get a degenerative meniscus tear as well. As I bet you can guess, there's a lot of symptoms of pain associated with this, but there's also some other symptoms you might want to be aware of if you're considering, do I or don't I have a meniscus tear, and how is it going to affect me? And that would be that you might have a lack of ability to bend your knee, swelling, tenderness along the line of your knee joint that we saw on the model. And then definitely symptoms like my knee feels like it's catching or getting stuck through the motion, or all of a sudden your knee might feel like it's going to give out or give way on you. Those are what we hear our patients commonly talk to us about with meniscus tears.
Yeah. So mechanism, injury, symptoms, we were talking about this earlier. Oftentimes some of these things overlap with each other. So you might hear us talk about some of these things today that we might have talked about in the past or we're going to talk about in the future. But we definitely use these things, right, guys, as a way to figure out, these are our clinical ways to figure out what is really going on. And, you know, the big discussion is, you know, does it really matter what's going on? Are we going to treat them the same anyway? And I think it just depends on, you know, the situation. So to us, it matters because we are going to treat these things that are problems and help our patients feel better. And how it occurs just helps us identify, it could be this. But a lot of times we're wrong. I mean, for me, I've had many cases where I'm like, I think it's meniscus, but, you know, it's really, you know, a ligament, collateral ligament, or, you know, so sometimes it unveils itself over time, you know, as well. So, Dr. Sandoval, talk to us about rehab. What does rehab look like for a person that has a meniscus tear, and how does that differ for someone who maybe has surgery or decides not to elect and have surgery?
Yeah, so there are going to be, like with many other injuries, there's an early phase, a middle phase, and a late phase when it comes to rehab. What changes when there's a surgical component to this is, you know, you might want to delay or prolong the early phase just a little bit more, just to be a little bit more cautious with the healing structures, you know, with that surgical procedure that was done there. But otherwise, you're going to want to achieve the same goals overall in the early phase. You want to, you know, promote range of motion. You want to get some more mobility in general. You want to get some more motor control of the surrounding muscles and some more sensory awareness of those muscles as well. In the middle phase, you want to build capacity. You want to build tolerance to different activities. So you're going to want to strength train and maybe introduce some plyometrics in there as well. And then towards the end, in the later phases, you're going to want to, if you're an athlete, get back to sport, right? And the way to get there is to introduce different athletic patterns, right? To get them ready to then perform some return to sport activities and then eventually progress them back onto the field so that they can compete with whatever sport they're involved with, right?
That's good.
And then another thing to consider is you want to always train the opposite leg as well, right? You don't want to forget that opposite leg.
Don't miss that. Dr. D put that in.
It might not be injured, but if you're not training it because of the injured leg, then, you know, that one can also, atrophy. You can lose some strength. You can lose some motor patterns in there as well. And we don't want that to happen.
Yeah, 100%. It's good stuff. So, for you guys, do you guys feel like early and middle phase or middle and late phase, those ever blend? Like where it's kind of like sometimes you can't really say they're in one phase or another. Is that something that you guys see happen with this particular injury?
Yeah, definitely. I think everything, like, you know, when it comes to strength itself, it overlaps throughout the entire course of rehab anyways. It might incorporate in different types of ways that are loaded in different types of ways based off of how they're presenting. But generally speaking, it's global. You're going to be using it the entire time. So I think it's all just kind of gray and merges together overall. Yeah.
What might affect someone's length of time for a meniscus rehab? Like what would affect them being here for 2 weeks, 4 weeks, 3 months, 6 months? What are the things that might impact the length of time that they would be here doing rehab?
I think one of the things that, I don't remember if we mentioned it just yet, but the location of the injury, right? If the injury is in the more lateral aspect, or not lateral, but
The outer
the
structure?
outer structure,
Outer
then
portion.
yeah, you tend to have quicker healing and better healing. Whereas if it's more in the inner structure, you're not going to heal as much, right?
Why? Anybody know?
I mean, I know.
Vasculature.
Yeah,
Yeah. The
vascularity.
blood supply they have different blood supplies to both sides. So yeah.
Yeah.
The outer sides you're gonna have a little bit more. Inner side probably not as much.
Yeah.
So where? What else? Is there anything else that might impact? They came out.
How?
How?
Yeah.
Okay.
I think depending on if it was a traumatic incident or like a degenerative incident, I think that kind of changes the type of approach that you would probably take. Because I think I just recently had one. It seemed like a meniscus injury, but just based on the mechanism of it, and she's 2 weeks from the incident, and she's back to jumping now. So I think just really depends on the severity of the mechanism as well.
Yeah.
Yeah.
Severity. What about the grade of the tear or
Shape of it.
Yeah, there are
or
different
where?
types.
Yeah, what type of tear it is, like a bucket handle versus.
Yeah, exactly.
Right. Yeah. So the type of tear could impact, or the type, and I would say I went to when we went to APTA recently, they've been talking a lot about the last year about meniscal root tears and how those are the tears when the root is torn. That is a typical thing that surgery is typically indicated because it's hard to like rehab that. Well, and it's new, so we don't know. Well, maybe in 3 to 5 years we'll find out we can rehab it easier than we thought we could, but that type of tear. But for the most part, I mean, like you said in the blog, right? Surgery versus non-surgical approaches, research shows right now that it kind of there's no difference, right? For a typical meniscus injury, you're going to have the same outcomes whether you do surgery or not, right? And we have those rare cases. I've had those meniscus, tears that I feel like there's multifactorial things going on. Like maybe it's a meniscus tear, but they also have, osteoarthritis, or there's something else going on that might be impacting, the typical rehab. But we do see generally speaking, sort of the same outcomes. And do you guys see that in your practice? That kind of a similar outcomes, surgical versus non-surgical? Yeah.
Absolutely.
Yeah.
I agree.
So what are the benefits for someone not to have surgery and just do like PT? How would they benefit? What would be the benefit? And I guess my 2-part question would be, do you think people need to know? Do they need to get a scan and know if they have it? So anybody want to answer either one of those?
Well, I'll start with the first question.
Okay.
Let's start with the first one.
Okay.
Let's say that this is a very high-level athlete
Uh-huh.
and they're in the middle of their season and they want to continue playing because there are a lot of high stakes involved and they can still play. Then in that situation, maybe we consider a more conservative route, right? And we at least hold off on the surgery for the time being, right?
Okay.
And then we try to rehab, just because, like we said earlier, if you have that surgery, right, you delay the early stage of rehab, and it takes longer to get back to where you were, right? So if you are in that situation and you are currently competing, and there are high stakes involved, and you're a high level competitor, then maybe we hold off on that just for now and reconsider that conversation at a later date. Right? That's just to answer that first question.
Yeah. In the bigger scheme of things with the healthcare system, does it save our healthcare system money for our patients not to have surgery or to have surgery? What do you guys think?
No surgery.
No surgery, yeah.
Costs less.
Cost less.
Yes.
Like insurance companies,
Simple.
if insurance companies can figure out how to manage that, they will save a lot of money, right?
Yep.
With this is why research is important, because it helps them make some of these decisions. And I forgot my second part to my second question. Does anybody remember?
I don't even remember.
Even those that go conservative and may have to have surgery later, they usually have a quicker recovery because of all the prehab they've done.
Yeah, that too.
They have better strength going in, so they come out much easier.
Yeah, it's good stuff. Those are great discussion questions for us to talk about because, right, nothing is one way. There's a lot of different factors that we consider when we're dealing with rehab. So I think we covered most of the things that people listening might want to know. Is there anything else you guys think they might want to know that we didn't cover about meniscus injuries?
I'm not sure. I don't think so. I think that was most of it.
No?
So
Okay. Well, Dr. D, what would you tell these listeners, these followers, are people tuning in, what would you tell them and wrap up about meniscus rehab in general? What would you tell them?
Well, we kind of went over it, I think, together, but regardless of if it is or is not a meniscus injury, if you're going to get or if you're not going to get a meniscus surgery, I think rehab is going to be the most important thing before and after the injury happens. So ideally, we want to prevent it as much as possible, but injury prevention doesn't really exist. But at least we can reduce the risk of injuries by doing everything that Dr. Sandoval just kind of reiterated as far as strength training goes, plyometric goes, making sure that we're going through all of our athletic patterns off season, in season, preseason, throughout the year in different types of ways. Obviously, depends on what part of the season we're in will change how much we put in of each component. But at the end of it all, the more prepared we are, the better we're going to be for any type of injury. So regardless of if it's a meniscus injury or not. So
Yeah.
yeah.
Perfect. Okay, guys, that's it for our discussion on knee meniscus injuries. If you want to know more or you want to tune in more, you can follow us on Instagram at Physical Therapy San Pedro. You can follow us on Facebook at Physical Therapy San Pedro. We are on YouTube at Physical Therapy San Pedro. We have a podcast that is going to be, this particular information will be up on a podcast shortly, so we'll be sharing that content as well. If you have an injury and you have more questions or you're looking to do some rehab, whether it's be in person or virtual, reach out, DM us, contact us, subscribe to our email list. We would love to help you. And I think that's it. See you guys next time.